Hi guys, welcome again to EMGS CourseTalk Series. So in the next few minutes, we will be uncovering some of the most important courses offered by the Malaysian universities. So feel free to drop your questions, okay, if you have any further questions about the program in the comment below. Our team will assist you accordingly. But before that, please follow all of our EMGS social media for more information about study in Malaysia. Today, we have a very special guest from MAHSA University, which is Professor Dr. Srikumar, the Director of Research, Innovation and Postgraduate Studies from MAHSA University. And for today, Prof. Srikumar will share with us the information about the Bachelor of Medicine, Bachelor of Surgery, MBBS offered by the MAHSA University. So, Prof, welcome to the program. How are you today?
Thank you so much, Raja Muhammad Fariz. It's an honor to be there, to be with EMGS. We do a lot of interaction with EMGS with international students. So it's a great pleasure to be on the same forum so that we can connect with you all.
Yeah. Thank you, Prof. It's good to see you here today in our session. Okay, and Prof, for the first question, right? I think we have some of the viewers here are wondering, what are so special about the MBBS program offered by the MAHSA University?
Thank you. Well, as such, career in medicine itself is a very coveted one anywhere in the world. I am a doctor myself, so I know how it feels to be in a noble profession which is grounded on the principles of service, compassion, empathy, care, and a whole list of things now that you know with COVID around. Now, our MAHSA MBBS program is a fully accredited homegrown program. This is a Malaysian program. And this aims to graduate young doctors who have the knowledge, skills, and competencies of the 21st century. So our program is integrated where the students, when compared to traditional systems in other countries, here it is subject based, it is module based. For example, we have a phase one, which is a preclinical organ based phase, which brings together all aspects of basic sciences. And then phase two, where we have a clinical environment with exposure to the hospital and the community. So it is a hospital-based program in year 3, 4, and 5. So our students are rotated through various medical disciplines in various hospitals. We have three main teaching hospitals: Hospital Sungabulo, Hospital Kuala Lumpur, and Hospital Tanjung Karang. So as you know, the first two hospitals are the main premier referral centers in the Klang Valley. And the third is a community hospital where the student is exposed to healthcare. So basically, our program also encompasses a PPD, that is, we call it personal and professional development, and that runs throughout the 5 years, which helps in medical legal issues and so on. So I think with this program structure, basically our students have a great opportunity to continue both here and in various countries. So our degree allows the students to sit for entry examinations in various other countries, and we have students from many countries already in our program.
Okay, that's great. Doctor, the next question, can you share regarding the employability rate for the graduate from this program and from which country now that they are practicing?
Okay, in terms of employability rate, I'm sure you would agree with me that at this point in time in the past 2 years, you would have realized that I think the best profession in the world is healthcare profession, because all over the world, everybody is actually going to see doctors everywhere. And when I mean doctors, I mean nurses as well, and all healthcare professions as well. I mean, at this point, it is well established that this profession is the best bet for anybody who wants to um, uh, have a good career pathway. Now, upon completion of our MBBS program in MAHSA, the students may listen to this very carefully. After the students complete, they will have to undergo a period of internship in public hospitals. This is prior to full registration with Malaysian Medical Council. This internship in Malaysia at this point is available only to Malaysian citizens. International students who apply from other countries at this point are not eligible for internship posts in Malaysia. However, this degree allows them to sit for entry examination in their respective countries to practice there. Now, traditionally, a medical degree means a career in clinical field of medicine, either based in a hospital or a clinic. But now this is changing. And as you see in the past 2 years, the professional portfolio of a doctor now encompasses multiple areas. This includes health industry, pharmaceutical industry, academia, research, international aid workers, even those who write in scientific journals and so on. So when it comes to opportunities, there are great opportunities for doctors, not only in terms of clinical practice, but in academia, in research as well. In the past 2 years, you've seen that COVID has created an impact and job opportunities for so many doctors. Now, with the vaccines rolling out, this has created opportunities for many doctors to help in the vaccination process itself. So, career opportunities, I would say, are unending.
Okay, okay, thank you. Because currently, due to the current pandemic, I think the healthcare profession is very important right now, right? There's a lot of demand for the professional in the healthcare industry.
Yes, definitely. Definitely. We need as many doctors, nurses, healthcare workers as possible, especially doctors, because there are many complicated cases in COVID, and we are short of doctors and short of hospital beds as well.
Okay, okay, thank you. And then, Prof, one of the important criteria for the students when they choose the program or university, okay, they will look at the academician background, okay? So can Prof share a little bit regarding the academician background of a lecturer who teach this program at MAHSA University?
Uh, we have over 150 faculty members. Many of them are very senior, qualified medical doctors in the country. We have a growing number of staff with medical education background to initiate, innovate teaching, learning, and assessment strategies. We have a very significant number of staff with memberships and fellowship in the Royal Colleges in the UK and in regional professional bodies. And this demonstrates that we are a benchmark among the best. In fact, I myself have got my membership in the College of American Pathologists. And we have many of our staff who got memberships and fellowships all over in many reputed colleges in the world. We also have a lot of academic staff who are actively involved in national and international scientific and medical education meetings. And our medical staff, medically qualified staff, are represented in the Malaysian Medical Association, Academy of Medicine, Malaysian Scientific Association, Academy of Science Malaysia. So we have a lot of staff who are distinguished and who have created an impact in the medical field in Malaysia. And we take the students through as mentees over the 5 years. We believe in personal one-on-one care.
So I think MAHSA, they offer a very high quality of teaching, right, to the students in terms of academician backgrounds, professions, and everything.
Very true. We put them through a washing machine, and the washing machine rolls every day from morning to night, and there's no end to studies. But we make sure that we mentor them well, and the students learn what they need to learn. That is the basic learning objectives of the medical program.
Okay, okay. Now, Prof, we have the last and I think most important question regarding the financial. Can Prof share a little bit regarding the tuition fee for this program and the basic entry requirement for the students?
Well, thank you, thank you. That is, I guess, the most important question. But before that, I would actually like to summarize that despite what I've told was about the teaching faculty, in terms of the exposure the students have, we expose them to reputable teaching hospitals.
Mhm.
Our system of teaching is problem based and with exposure to clinical skills, and we have the latest digital anatomy facilities, and we have a good case mix of patients, and our medical program is international recognized, and we have students in various countries as well. So with a gamut of such wonderful features, our medical fees for international students is at an affordable price of about 435,000 ringgit for a full 5-year course. This includes the tuition fees, the registration fees, the application fees, and the yearly fees on the whole. So I hope that answers your question.
Yeah, I think it's around roughly, if you convert to USD, about 100,000 US.
Yes, 100,000 USD.
Yeah, for the whole 5 years program.
Yes, for the whole 5-year program. Yes, exactly.
Okay, and then how about the like basic entry requirement for the students?
Okay, the basic entry requirements, we have, um, okay, it depends on where the student has studied and which program. Now, we have students from other countries such as the Sri Lanka Medical Council, the Thai Medical Council, and a few other countries and Medical Council of India as well, who have joined our program, and they are doing very well. Now, in terms of basic educational requirements, students who have done their STPM and A levels, we have grades. They need to have a minimum requirement of BBB or ABC or AAC in 3 subjects, which is biology, chemistry, and physics or maths. Now, those who have done their foundation in science or matriculation, the minimum CGPA of 3, and the 5 grade B in bio, chemistry, physics, maths, and 1 other subject at O level. And those who have done their Australian matriculation or Canadian pre-university, average of 80%. And IB is at 30 points. And for all these students, an English proficiency, we need a band for MUET or IELTS 6 or TOEFL 550.
Okay.
That's
So
a whole lot of figures that's coming out of my mind right now. But yes, these are the right figures.
yeah, it's okay. I think for the students who need more detail, they can contact us later. Okay.
Yes, anytime, feel free to contact us. We would be only too helpful to help them choose a career path and also to counsel them on various aspects as well.
Sure. Thank you, Prof, for being with us today and share a valuable session regarding the MBBS program in MAHSA University. No doubt it's quite, I think, affordable medical program offered by the MAHSA University. And also they have a very high quality of teaching to all the students. So to all of our viewers here, if you have a further question about the MBBS program, or about study in Malaysia, feel free to send me your email to my email, rajafaris@educationmalaysia.gov.my, or you can just send a message on our Facebook page. Okay, and again, thank you, Prof, for being with us today. But before we end the session, we would like to share a special message from EMGS CEO, Mr. Muhammad Razlan bin Jalaluddin. With that, I hope to see you again in the next EMGS CourseTalk Series. Stay tuned and bye-bye.
Assalamualaikum warahmatullahi wabarakatuh. Hi, and welcome to all students. I'm Muhammad Razlan bin Jalaluddin from Education Malaysia Global Services. Thank you for joining EMGS CourseTalk Series. Malaysia is definitely the best choice for you to pursue your studies, regardless of programs or level of studies. Our quality of education is well recognized globally. The cost of living here is reasonable too. Malaysia is a beautiful country that is strategically located in the heart of Asia. You can experience a dynamic lifestyle with exciting adventures and places to explore.